got a great turnout today for a wonderful activity here, especially cutting the ribbon here on this beautiful facility that's behind us. So let's go ahead and get started. Good morning again. My name is Don Miles, and I'm the chair of the Wake County Board of Commissioners. And it is my privilege to say, for the very first time, welcome to our brand new County Public Health Center. Yeah. I am so glad you all are here to help us celebrate this exciting accomplishment. It feels like it was just the other day that we was getting our shovels in the dirt right here to celebrate the start of construction. But I know that for hundreds of public health staff and the hundreds of people who built this facility, this day couldn't come fast enough. This is an incredible facility. I highly recommend you take the opportunity to tour it later because it is truly just awesome. This new public health center is a whopping 154,000 square feet. That's nearly a whole football field of space for our amazing providers to care for Wake residents. Within these 4 floors, staff will be able to serve 100 patients at a time, and 88 exam rooms and 20 dental treatment rooms. That's a good thing, because last year, Wake County Public Health served more than 25,000 patients in our clinics. That adds up to more than 6,000 clinic visits every month at Sunnybrook and our 5 regional centers. And we know the need for this vital care is only increasing. One of the most important things about the center is how specialized it is. A lot of people collaborate on this design, and they thought of every detail, from making visits easy for families with small children to simplifying filling prescriptions. The moment folks walk through the door, they'll feel welcome, comfortable, and considered. The waiting area, clinical spaces, allow staff to treat the whole person in front of them, meeting patients' unique needs as a team. Holistic care has better health outcomes than when people have to run all over the place to piece things together for their medical care. This center has cutting-edge technology to support our top-quality medical care. This facility will replace the Sunnybrook, which has enabled Wake County to do a lot of good things here for the last 38 years. But medicine has advanced a lot in that time. Back then, we didn't have vaccines for chickenpox or HPV. We didn't know as much about prenatal nutrition. Back then, you had to have a physical piece of paper to take to the pharmacist to get a prescription filled. On top of all the technology, this health center has a large parking garage and is close to public transit. It's just as important for folks to get to the front door easily as that they're treated well when they walk through it. Wake County committed to making a great medical care assessment to all our residents. This public health center opens next month is a big stepping stone. And at this time, I'd like to recognize my fellow commissioner and colleagues. So if you're here, I'm sure all other 6 are here, so please stand. Our Vice Chair, Sophia Jackson, Commissioner Susan Evans, a little under the weather, not here today, but we definitely send her our prayers. Commissioner Vicki Adamson, Commissioner Shanika Thomas, Commissioner Cheryl Stardom, and Commissioner Tara Waters. Thank you all for your commitment and dedication to making Wake County a better, healthier place for our residents. And lastly, I always like to end my speeches with, because I find it fitting for what we do, and that is, I am you, you are we, and we are Wake County. And now I would like to bring up our county manager, Mr. David Ellis. And for those of y'all who haven't had the pleasure of working with David, he is fantastic. As I tell folks, everywhere I go around the county, all the other city managers always saying, man, where's David? I need to talk with David. I want to work with David. And of course, we go outside the county. You got other counties say, hey, look, we need to get David over here. And I'm saying, no, we're quite pleased with what we do. And with last but not least, come on up, David, and give us your applause and your good stuff.
Hey, good morning, everybody. So, Chair Mile, thank you for the kind words. So 2 years ago, we sat here, we did the actual groundbreaking, and it was cold, so I guess it's appropriate that it would be cold today as we have the actual opening of the building. But this is truly a momentous occasion. I tend to be very reserved, and I don't get too high or too low because, as Dr. Taylor will tell you in our job, you want to keep it even. But this is exciting. I had the opportunity to take a tour of this building last week, and I think Ben Canada is probably tired of me inviting everyone that I see, like, you've got to see this building. And in a little while, I'll tell you what's, from my perspective, what's so special about this building. But just briefly, we all know Wake County's continuing to grow. We've got about 1.2 million folks here. 66 people a day are moving here. And that equates to about 24,000 individuals in Wake County every year. That's enough to fill the Lenovo Center when the Canes win the championship this year, right? We have young people, we have old people, we have married couples, we have divorced couples. We have folks coming out of college who want to live in Wake County because of the quality of life. That presents challenges, but we are up to the challenge. The Board of Commissioners has been very proactive in a number of areas, and I would encourage you to actually take a look at the board strategic plan, because in the board strategic plan, they talk about community health and making sure our community is healthy. And a community can't thrive unless a community is healthy. And so when you look at this building, you look at the demographics changes, you look at the commitment of the Board of County Commissioners, this is what you get. You don't get some rundown building that looks, like, I won't say that word, though it doesn't look well, right? You get a top-notch facility where people can come in and feel like they're being treated like they should be treated. So, but none of this would be possible without our partners. And Dr. Rawls, I had to take my hat off because the head was getting a little too hot, but I had my Wake Tech hat on. But as many of you know, there was a Wake 3 where Wake Tech, Wake Med, and Wake County came together to create a medical campus. You get three large bureaucracies like this, and the fact that we were able to work together, we were able to swap some land to make all of this possible. And I would encourage you, as you leave here, you'll see some of the development that's already starting to occur with our other two partners. This, in many ways, building is very special. For those of you who know or knew Dr. James West, Dr. West was just an amazing man, an amazing elected official, but more than that, an amazing man. And Dr. West would always say he was high touch, not high tech. And he was always concerned that we may take the technology too far and we lose the touch, we lose the feelings, we lose the empathy and things of that nature. Folks, when you walk in that building, this is the perfect fusion of high tech and high touch. Everything in there has been put in there to make sure that individuals who walk in that building, they are seen, they are heard, and they will receive the best treatment possible. And so lots of technology, but you can look at the artwork, you look at everything that went into this building, and it just makes me think of Dr. West, and I know he's looking down on us going, you guys got it right. So let's give Dr. West a hand. So, good to see you, Donald. I will say this, I'm going to close out because my father, who was a Baptist minister, taught me one thing. Sometimes you got to know it's not about you, and I'm not going to be before you long. And so now I'm going to turn this over to Rebecca Kaufman, who is our public health director, and she's going to talk to you about some of the intimate details about this building and things that are included. So thank you all. Commissioner Adamson, did I do okay? Okay.
Good morning, everyone. I just have to say, I start out each day telling my kids today's going to be an amazing day, and today truly is an amazing day. I can't get over the feeling of having you all here with us today, so thank you. I want to echo the excitement shared around what an important day today is for Wake County. The building we're standing in front of has been years in the making. Plans for this new home for public health were already in motion when I joined Team Wake in 2021. And I'm so excited to see it come to fruition. I have to say, it's very refreshing to work for a county that prioritizes the health of our community and our residents. Our leadership and elected officials understand something fundamental, that strong communities start with strong public health systems. In my experience working in local public health, not many health departments have a facility as beautiful and state-of-the-art as the one behind me. This new center is more than a building, it's a promise. A promise that we will continue to invest in the health and well-being of our neighbors, friends, and families. If the past few years has taught us anything, it's that public health is essential. It's one of those things that people don't always see, but they feel. It's every day, whether you recognize it or not. Public health is quiet, steady force that keeps Wake County safe, healthy, and thriving. And this new center shows how essential that work is. Inside these walls, we'll provide a full range of services that touch every stage of life. This building will be home to our pediatric clinic, family planning and prenatal clinic, WIC, dental, TB and refugee health, immunization, infectious disease, and STD clinic, just to name a few. Clients will come here for education on a variety of public health topics, from parenting education to nutrition. You'll be able to get your well water tested and learn how to install a car seat. Our clients know that they can come here and find a trusted source of information and a staff who truly cares about them. When residents walk through these doors on Monday, February 23rd, they'll experience a new centralized check-in process and more than 100 clinics rooms designed for comprehensive care. From a TB clinic equipped with negative air pressure system to lactation spaces for nursing mothers, every detail was designed with care and safety in mind. These services will make it easier for residents to access treatment, information, and support all under one roof. And with social services just a short walk away, we're creating a true health and human service campus for community well-being. Thank you. None of this would be possible without our amazing public health staff who work tirelessly every day for our residents. This is why we've made sure the new building offers a bright, modern feel that our nearly 700 staff members who make up public health. With cubicles, offices, conference rooms, and break rooms, space will no longer be an issue, and our team can grow to better accommodate the needs of the clients we serve. I know a lot of my team is here today, and so I want to take a moment to recognize all of them. Your dedication and compassion are what make public health work. I know you're just as excited as I am to start our next chapter in this beautiful new space. Thank you all for coming out today to celebrate with us. A special thank you to the Health and Human Services Board, the Board of County Commissioners, and the County Manager's Office for your support and making this building a reality. I'll now hand things over to Congresswoman Deborah Ross, who played an important role in securing this funding to make this dream of this space a reality. Thank you.
Well, good morning, everybody. What a beautiful, crisp, sunny morning to celebrate. Thank you so much, Director Kaufman, and thank you to everyone here for joining the opening of the new Wake County Public Health Center. This announcement is an exciting step forward in our mission to ensure that every member of our community can access the care that they need. This achievement didn't happen overnight. In fact, it was just over 2 years ago that many of us stood at this spot, as we've alluded to break ground on the Public Health Center. And I'm incredibly grateful for the determination of the dedicated healthcare professionals, community leaders, and local residents who worked so hard to make this amazing day possible. In 2022, I secured funding for 15 community projects that were developed by the people of Wake County for the people of Wake County. And President Biden signed this funding into law, delivering $2 million to help bring this project to life. I was honored to play a small role in the construction of this new healthcare center, a facility that will help more residents get exceptional health care. And we all know access to a physician and preventative care makes a significant difference in addressing major health disparities. From seniors in need of cancer screenings to young moms seeking more information about pregnancy and parenthood, Wake County's team of experts will continue to deliver outstanding care to some of our most vulnerable and underserved communities. It is no secret that healthcare is increasingly unaffordable, forcing too many families to choose between putting food on the table and caring for their loved ones. Please know that in Washington, I am doing everything in my power to lower the cost of skyrocketing health care, including helping with this amazing community health center. I'm grateful that we have partners in Wake County who are so committed to caring for our residents and ensuring that they have the support that they need to lead healthy lives. By investing in preventative services, the Public Health Center will help more of our people live longer and healthier lives, and that's something we can all celebrate. Again, I want to extend my deepest gratitude to every single person who's here today who has made a difference in the health and well-being of our community. And now I will turn it over to Commissioner Tara Waters to share some remarks.
Thank you so much. Good morning, everyone. It was certainly a cold start to the day, but I think the warmth in our hearts has made it all worthwhile. I am Tara Waters, the Wake County Commissioner for District 5. I love celebrating a healthier Wake County, and it's a bonus when it's right here in my district. The new Public Health Center is a symbol of our commitment to the health and safety of our whole community. That commitment is shared among everyone who has made this day possible. Almost 2,000 people worked on this facility. And while we don't have time to read each of their names, I want to especially thank the Skanska team for your incredible work building this facility. Can we give them a round of applause? I also want to thank our architects and designers at LS3P and O'Brien Atkins. The intentionality behind each space, like the special waiting room for families visiting the Children's Dental Clinic, shows how much we care for our residents. And as a mother who has had to take my sons to the dentist, I'm especially thankful. Next, I'd like to thank Congresswoman Deborah Ross and her staff. Projects of this scale are only possible with care and collaboration, both of which are showed when you advocated for our federal funding. Speaking of advocating, thank you for our Health and Human Services Board members, including my colleague, Commissioner Cheryl Stallings, who continues to drive health-focused and compassionate decision-making. Thank you again to my fellow commissioners. I know the board was enthusiastically invested in public health for many years, and we wouldn't have been here without that. Thank you to the Wake team members in Facilities, Design and Construction and General Services Administration for their development and management of this important project. And I too want to thank our County Manager, David Ellis, and the entire County Manager's Office for their vision and commitment to our residents and always centering people in all the work that they do. And last, but certainly not least, thank you to our public health team, not only for the work you've done so far, but the work that you will continue to do. Helping over 25,000 of Wake County's most vulnerable residents is no small feat. On February 23rd, when those residents walk through these doors for the first time, they'll obviously be wowed by this building. But it's the compassion in your eyes and in your actions that make the biggest impact on them. I know that you'll continue to provide them with high-quality care and kind customer service. I wish to thank each and every one of you personally, but we'd be here all day if I had to do that. And I know everyone is eager to see inside this beautiful space for themselves, so let's cut this ribbon.